Our first speaker tonight is Sandra Fitzgerald, and my introduction tells me she's a PhD student, and I've just been chatting to her to discover that she's already submitted her thesis. She's already got her examiner reports back, and so she's very nearly Dr Fitzgerald, and so she's bringing tonight a huge amount of experience. She's previously been a senior technician working on the Neuroendocrine Cancer Project. She did a master's at University of Auckland in molecular biology, and since then she spent 6 years working for Genesis Research and Development Corporation in the forestry division, and then took a bit of time off to travel and have a family, and then moved into breast cancer research. And from there she saw the light and moved into neuroendocrine cancer. And this evening her talk is titled, "Can we improve monitoring for people with NETs?" So Sandra, give a wave, and I will go on to mute, and it's over to you.
Thank you so much, Michelle. That's great. I'll just endeavour to put my slides on, we did try this earlier to make sure it works. Can everyone see that? I hope so. Thank you so much for the opportunity to come and speak tonight. As Michelle said, I'm just winding up my PhD, but it's been a great experience, and working with neuroendocrine cancer is also a great experience, as is the Unicorn Foundation. So we had several years ago, we had a meeting with several of the Unicorn Foundation members, and we actually went to them and said, what can we do in our research setting that would help you guys and your experience with cancer? And one of the answers that we received quite resoundingly was they would like better diagnosis, especially less invasive ones. So this sort of kickstarted this idea of we need to really start developing something better. And my research has really been based around the development of a liquid biopsy assays. And this is for the detection of cancer, but also for the monitoring of mutations in cancer, actually several different cancer types, including NETs. And I'm just going to tell you a bit about that tonight. So before I start, what is a liquid biopsy and how can it help you? So as most of you will know, the difference between a tumour cell and a normal cell is often a mutation in the DNA. And when you have a tumour, sometimes some of this mutant DNA can actually shed into the blood. And by taking a blood sample, we can actually capture some of this mutant DNA and really get an insight as to what's going on in the tumour right at that moment in time. And we're really hoping, and there's a lot of people internationally looking into this, how can we harness this information and what can it tell us? So some ideas: can we help with the diagnosis of NETs? Can we help with the treatment selection and monitoring of patients who have NETs? And this is really relevant now that PRRT is now available in New Zealand. And finally here, what about the watch and wait scenario that a lot of NET patients are undergoing? How could we use a liquid biopsy assay or a blood test to help monitor their disease over time and use this information alongside the standard scans and clinical appointments to just give the clinicians a bit more information? Now, based on some of the research that we've done in our research group, we know that NETs are not the easiest tumour types to start with. In fact, they don't have a lot of mutations at all. So we decided that perhaps we would start somewhere that we're more likely to be able to develop our assays. So I'm just going to segue into melanoma for a minute. Along with National Science Challenge Healthier Lives Initiative, we chose melanoma, well, I should say Parry Guilford and Chris Print chose melanoma because it has in New Zealand one of the highest rates in the world. And because this is predominantly a UV-driven cancer, the DNA tends to have a lot more mutations. So the chance of us being able to pick up these mutations in a blood test or a liquid biopsy is much higher. We really looked at two different scenarios with our melanoma patients. The first scenario is patients that have had surgery, and we were monitoring for disease relapse after their surgery for up to about 3 years. The second question that we were looking into was for melanoma patients that have metastatic cancer and are undergoing immunotherapy treatment, how could we use a liquid biopsy assay to monitor their progress? Are they responding, or are they progressing their treatment? And that's one example I just want to share with you quickly. So this is an actual patient. And what you've got here is on the y-axis is the actual detection of the DNA mutation out of a blood sample. And on the x-axis is over time. The blue triangles show exactly each blood test that we analysed. And this particular patient had a high amount of tumour in their blood before they started treatment. And at the bottom that I've just brought up, this is our scientific output. This is what we actually generate. And each blue dot represents the detection of one piece of mutant DNA in the blood sample. The green dots are actually the normal DNA that we also detect. So you can actually see that this is a large number of dots, and it's reflected a high level of disease. However, this patient responded very, very well to treatment. And at 450 days after they started treatment, we cannot detect any mutation in their blood. And they're continuing to be monitored on our research study. Now, this is a research study, so this is not being used for clinical information at the moment because we want to be sure this technology is robust and that it is accurate. But what we have the benefit now that we can go back and look at our liquid biopsy results and see how they compare to the clinical standard, the scans and the clinical investigations. And so far it's looking very encouraging. So what about NET cancer? That's what we're here for tonight. So we went back and thought, well, how could we apply liquid biopsy techniques to NET cancer patients? What would be good clinical questions to ask? The first clinical question we came up with was when a pancreatic mass is seen on an image or a scan, it's very hard to tell if it's a neuroendocrine tumour or if it's an adenocarcinoma. And obviously, it's quite a different treatment plan and a time frame. And also to distinguish a NET adenocarcinoma is a very invasive procedure requiring large needles and some such. The second clinical question that we wanted to investigate was, similar to melanoma, could we use these liquid biopsy assays to monitor the progress of an individual patient's disease? So we started investigating these two concepts. The first concept, the distinguishing between a pancreatic mass, we had some success and we could identify mutations in the blood sample or in the liquid biopsy for about half of the patients we investigated. However, we couldn't definitively say that this mutation was a NET mutation and this mutation was an adenocarcinoma mutation. So we've had to go back to the drawing boards for this clinical question. However, for the monitoring question and the following of a person's disease, we believe we've had some much more encouraging results. This is just one example of a patient that's had a long time NET diagnosis. They have a pancreatic NET and that was surgically removed. However, they did have a relapse. Now, as before, the blue dots represent the detection of their personalized mutation in their liquid biopsy or their blood sample. After they had this relapse, this patient had PRRT and they had a remarkable response. And with using our liquid biopsy, we could not detect any mutation in their blood. Unfortunately, this patient did go on to relapse, and again, we could detect the mutation in the blood. So what we have here is a proof of principle. We showed that we could detect the mutation, we could design a patient-specific assay, and then we could follow this patient over time. So we're really encouraged by these results. We also realized with this experience that NET patients are a little bit like unicorns. Each is very unique. They have their own individual mutations, and so a personalized approach is going to be required, and I think we can do it. So I like to reflect on this because I feel like liquid biopsy is not going to be a straight path. It is a long and winding road. But what we're really aiming to achieve is that NET patients spend a bit less time queuing for a car park at the hospital and a bit more time being able to chill out on their batch on the beach. We think we can get there, and we think that we can get a better understanding and take a personalised approach to NET cancer so that we can use these types of assays to really figure out what the tumour is doing, is it responding to therapy, and how is it changing over time. I would just really like to thank the families and their patients and their families, because without your generosity, we wouldn't have the samples to do any of this work. Our research wouldn't be possible. And I'd also like to thank the Unicorn Foundation, Siobhan and Michelle, your predecessor, You guys really help keep us on track. You help us see what is the most important thing, and that is making a difference in the patient's lives. And I'll be happy to take any questions.